Hello viewers. Today we will be discussing about an eye-related condition called digital eye strain. Since more and more people are using digital devices for extended hours, we decided to throw some light on this condition. We'll be learning more about the factors leading to this condition.
With the evolving lifestyle changes during the COVID-19 pandemic, we are getting more glued towards the digital devices. The real danger is not the digital devices per se, but the amount of time we are spending on these devices, be it work, online classes, school, or just for fun. The excess screen time is pushing a big chunk of population into a condition called digital eye strain. A few years back, this condition was also called computer vision syndrome and was mostly seen in computer users who were confined to the offices. With the advent of technology and newer forms of digital screen, we have invited this problem to our homes. And with the advent of smartphones, we have introduced it to our bedrooms now. Since the effects are not very visible immediately, we tend to take this entity lightly. Also, many are not aware of the symptoms which are due to this digital screen use. The long-term effects of digital eye strain are profound. In case of kids who are now doing online schooling and spending even more hours on the screen, DES and myopic condition are growing in young patients. So what is this digital eye strain? This is a physical eye discomfort condition which starts with excessive digital screen use. The use may be more than 2 hours or more. The effects are like short-term and long-term. The short-term effects are blurred vision, headache, nausea, change in glasses and still the patient is unsatisfied, neck, back and shoulder pain, redness of eyes, burning, watering of eyes when looking at the screen, dryness, grittiness. The long-term effects are still under research as the digital screens have evolved pretty quickly over the last decade. And the exposure of this digital screen and the long-term effects and indirect effects are on the overall health of a person. Some of these effects are early cataracts, depression, obesity, permanent macular damage, memory issue, cancer risk. So these are few of the long-term effects. Now, what are the factors which are causing these damages? The first is flickers. The images which are formed on the screen are made of tiny display units called pixels. These pixels cause a constant but invisible flicker of the digital screen display, which causes multiple contractions and expansions of the pupil of the eyes. Prolonged exposure leads to a condition called retinal shock, which leads to symptoms of eye strain, fatigue, headaches, similar to migraine, or it can be even worse. Some complain of sensation similar to motion sickness, even at the sight of the screen. The second factor is blue light. This is a new buzzword in the ocular world. Blue light is nothing but high energy visible light. It is present everywhere, and the sun is the major source. It is this light which makes the sky look blue. The cornea and lens of our eyes can filter UV rays, but they cannot filter the blue light, which directly hits the retina of our eyes. Even the UV-coated sunglasses, they cannot filter this light. The blue light is the main culprit for the short-term and long-term damages leading to DES. The short-term effects like eye strain, blurring, headache, and the long-term effects like early macular degeneration are the effects of blue light. The other effects of blue light is with the chronic sleep issues. Blue light also suppresses the melatonin secretion, and melatonin is helpful for a good night's sleep. Blue light is of a more concern in young children as they spend average time of 3 hours watching TV, mobiles, playing games on screen, and avoiding the outdoor games. The third factor is reduced blink rate. So the normal blink rate is 10 to 15 blinks per minute. When you're watching the screens or working on the screens, unknowingly, people tend to blink less. Anything less than 10 can lead to drying of the ocular surface, which leads to redness, dryness, gritty feeling, along with blurred vision. This condition is often seen in contact lens wearers. Fourth factor is glare. So what is glare? It is the brightness within the field of vision, which causes discomfort, annoyance, and eye fatigue. Commonly, it is seen with faulty light installations, which reflect wrong amount of light from the digital screens into our eyes. The fifth factor is the ocular limitation. There is a difference when you are reading a book and watching digital screens. Our eyes are naturally at rest when staring at 20 feet away. They are never meant to stare at screen which is at 18 to 24 inches away from our eyes, and that for too long periods. This leads to spasm of the ciliary muscles which adjust our vision for near objects. The spasm leads to headache, fatigue, and blurring. And when you're back from work and trying to look at objects at 20 feet, you start getting the discomfort. The last factor is the ergonomics. So computer ergonomics is a very essential factor. When you are positioning the computer screens, sitting in front of the screen or the foot position, uncomfortable positioning can lead to stooping on the screen and leading to excessive digital screen effects. So guys, during this paramount time, it is tough to stay away from our screens, but let's limit our use to few hours during this new normal and save our eyes for future. Thank you.